Thank you, Annie. Thank you for the excellent presentation. And thank you all for being here for this joint session. And in the next 10 minutes that I have in my disposal, I will try to present to you a recent project that we have undertaken on a very trendy topic, which includes the utilization of virtual reality in mood disturbances. But before I do that, I have nothing to declare. And going right away to the problem at hand, we all know, and the evidence shows that patients, when they undergo treatment, they experience a very stressful situation, a very stressful and burdensome period, both for the patient and the family, where mood disturbances or mood swings, if you prefer, they tend to have a high prevalence. The disturbances seems to be peaking during this treatment session, irrelevant of the treatment. So the question that arose is whether virtual reality applications could be a solution to the problem. Well, there are many options to use in terms of virtual reality, and for this case we used immersive reality. And the reason why we preferred immersive reality is because the patient or the user of virtual reality has no interaction with the environment. So it's immersive into a virtual environment when the intervention actually takes place. So by using immersive reality, you convincingly persuade the patient that the actual environment is suspended and he is actually experiencing a virtual environment where it's much more pleasant than in real life. So this was a crossover double-blind randomized trial with 40 patients assigned equally to the two arms. It was cross-sectional, multi-center, and that's the identifier if you want to look for it. Inclusion criteria, we tried to be as general as possible. So we used some specific criteria to make sure that we didn't have any patients on the study that they had some challenges in order to use virtual reality. For example, the attentional function index. Patients were excluded if they had brain tumors because we wanted to avoid the likelihood of having seizures when actually using the virtual reality. If they were in palliative care, they had impaired or cognitive ability, or they had an impaired visual ability. Although the system allows the users of glasses, it's not optimized yet. So the intervention was a VR imaging application to be experienced with a head-mounted display simulating movement, manipulating through a gesture controller, and to experience fully spherical 3D videos or virtual environments. This is a snapshot of the actual environment that the patients were experiencing during the study. This is not an actual patient. That was the oncologist who was very happy to use the VR system. So what was the control? The control was guided imagery. We developed floating on a cloud script for our patients. We did, however, develop another alternative script, which was a visual environment on a beach. And the alternative script was for those patients who said that they had a fear of heights. So the guided imagery, it's a more traditional mind-body technique that focuses the imagination in proactive and positive ways. Several validated measures were used, such as the POMS, facts, and the patient's vital signs. So personalization starts from scratch, and this is not figuratively, but literally, because if you don't design a digital intervention in the way, as Wendy mentioned earlier, in a way that the patient expects or wants to, then it's not likely to be very effective. So the virtual environments were designed in collaboration and based on the patient's perspectives. We used a very rigorous process, so we started from reviewing the literature, then we held interviews with the patients, then, individual interviews, then we went to focus groups, and then we pilot tested the intervention in the lab, and then we piloted the intervention in the clinical setting. We needed to make sure that these environments that we had developed were realistic, and they allowed connectedness with the actual users. So these are actual words by our patients. I want to be somewhere enjoyable and relaxing. Having the opportunity to travel elsewhere than here, simply take my mind off this attachment to the drug. So we use the actual words that the patients used in the interviews and the focus groups. So the preliminary findings from the personalization effect or outcome, or how successful we were. So the themes identified included relaxing experience, an altered perception of time, distraction from the hospital environment, and the actual treatment process. So participants referred that the intervention, referring to the virtual reality intervention, was one of the most amazing things they had the opportunity to try or experience. 18 patients out of the 40 stated that the intervention gave them a relaxing time during the actual chemotherapy session. The intervention facilitated their forgetting and altered their perception of the time of their treatment and distracted them from the hospital environment. As I said in my beginning of the presentation, this was an immersive virtual reality, so it does not allow interaction with the actual real environment. The majority of the participants mentioned that they prefer this kind of interventions rather than to speak to their psychologist or with their close relative or friend. They meant in terms of controlling their mood disturbances, not in general. So the take-home message: conventional wisdom takes about 20 years to become common practice. So virtual reality is quite at its infancy in terms of controlling symptoms within cancer care. So virtual reality has emerged as a viable tool to help in a number of different disorders with the most strength of evidence for use in exposure therapy for patients with anxiety disorders. Our study provides evidence on VR effectiveness during the actual chemotherapy session, but it also provides evidence on the personalization effect that we achieve through the rigorous process of developing the actual virtual environments. Results shows that VR is and can be an efficacious tool compares favorably to guided imagery and has lasting effects that generalize to the real world. So whilst VR is promising, which is a virtual life, it's a virtual environment, real life is also beautiful. Thank you very much for your attention.